I like dabbling in kind of arts and crafts stuff. I'm in a pottery class. I'm not very good so far, but I like to pretend that someday I might be. And you know, just kind of other crafty stuff around the house. And traveling. I really love traveling. This is my other hobby, I'd say. Most recently, for fun travel, I went to Ireland with my family this past summer. But then for kind of, you know, health care related travel, I went to Kenya last February. I was teaching nurses there to do cervical cancer screenings. My husband and I both like to watch movies too, so that's our usual date night is we'll head down to Madison and see a movie at the Sundance Theater there. So when I was in high school, I felt like I had that kind of sense of wanting to work internationally, actually. And going through my classes, it just seemed like healthcare was a good fit. Like I was just really good at science, and you know, I think I'm a person who cares well for people and communicates well most of the time. And so it just seemed like the best sort of fit. And family medicine feels that same way. And I found that you know, this is really where my strengths lie, in kind of seeing the whole patient and not just kind of one organ system, and seeing kind of the patient over the span of their life. What I really truly love about my small clinics is that my receptionist knows everyone, and you know, so I'm new in town, but they can give me kind of the context. I mean, you know, I want to hear the story from the patient, but it's nice to have, you know, other people in my office who know the patient and their family really well, and can help fill me in and welcome me into the community. I try to do shared decision making with my patients. So I don't think it's very effective if I tell you to, you know, if I tell you to eat 8 vegetables a day and to run 2 hours a week, and you go out and ignore me. And so, and I don't do those things, and I don't expect you to either. And so what I really try to do is help my patients set realistic goals that I can help them achieve. It's such an honor to be involved in people's lives in in so many different ways. The reason I chose family medicine rather than kind of other specialties or combinations of specialties where you can see both children and adults is because I wanted to be able to deliver patients. And the reason I chose to train in a rural setting is so that I could also learn to do C-sections, because I really want to be able to be there for that mom that I'm seeing prenatally kind of through the whole of her pregnancy. You know, there are always times that things come up, but for the most part I plan to be there for my patients' deliveries and be the one delivering them, you know, whatever way they need to be delivered. Patients are good, I don't know, you know yourself so much better than I know you. You know, you have lived with your body day in and day out, and I get, you know, 15, 30, maybe an hour with you. And so if you're feeling like something is wrong, don't hesitate to come in. And it may turn out to be nothing, but that's, you know, that's not your job to sort out. You know when you feel weird, I'll help you figure out if that's something to be worried about or not.